What is cutaneous myiasis? If you've ever heard of a condition where fly larvae infest human skin, you might be wondering what it's all about. Let's break down the details of cutaneous myiasis to understand this unique and somewhat unsettling condition. Cutaneous myiasis is essentially a skin infestation caused by the larvae of certain fly species, specifically those belonging to the two-winged flies or dipterous flies. This condition is more common in tropical and subtropical regions, but with increased travel, it's becoming more recognized in other parts of the world as well. There are three main types of cutaneous myiasis: furuncular, wound, and migratory. Furuncular myiasis is the most common type and involves the larvae creating a cavity or furuncle in the skin. This type is often caused by flies like Dermatobia hominis, found in South and Central America, and Cordylobia anthropophaga, found in sub-Saharan Africa. Here's how it typically happens. The adult fly lays its eggs on an object or another insect that comes into contact with human skin. When these eggs hatch, the larvae burrow into the skin, where they feed on the host's tissues. The larvae can grow up to 1 to 2 cm in length and create a central opening in the skin with serosanguineous drainage. You might feel itching, a sensation of movement, and sometimes sharp pain. The lesions from Dermatobia hominis are often found on the face, scalp, and extremities, while those from Cordylobia anthropophaga tend to appear in areas covered by clothing, like the head, neck, and back. Wound myiasis occurs when fly larvae infest open wounds, and migratory myiasis involves the larvae moving under the skin surface, creating long, serpentine tunnels. Diagnosing cutaneous myiasis can be tricky but usually involves clinical suspicion based on the patient's history and physical examination. Dermoscopy, which allows for a close look at the skin, can help identify the larva's posterior spiracles when it's close to the surface. In some cases, skin ultrasound may be used to visualize the larva and its movement under the skin. Treatment typically involves extracting the larva. One method is to occlude the skin opening with something like petrolatum or nail polish, which can cause the larva to come closer to the surface, making it easier to remove. In some cases, surgical removal might be necessary. Oral or topical ivermectin can also be used to kill the larvae or induce their migration. Preventing cutaneous myiasis involves using insect repellents and wearing protective clothing when traveling to endemic areas. So, if you're planning a trip to tropical regions, it's good to know about this condition and how to protect yourself. In summary, cutaneous myiasis is a skin infestation by fly larvae, with different types and specific symptoms. Understanding how it occurs and how to treat it can help you stay safe and healthy, especially when traveling to areas where this condition is more common.